Hello viewers, welcome to Healthline TVASIATELUGU channel. Once again, this is your host Varsha Singh. Every episode we have someone special coming to this series who is a specialist and who has a lot of health information that you can use to improve the quality of your life. This episode is one of a special series that we are creating for you. This episode is SATHI series. SATHI, South Asian Total Health Initiative. This is a non-profit group based in Rutgers Medical School in New Jersey. And this is a non-profit organization which has physicians and healthcare providers who provide their valuable time and energy, and their effort is to improve the health knowledge within the community, provide them with the most current and correct information about their health so that they can take preventative strategies to improve their health. Today, we have a very special guest in the SATHI series on Healthline at TVASIATELUGU channel. Please welcome with me Dr.Usha Ramachandran. Dr. Usha Ramachandran is Associate Professor of Pediatrics at Robert Wood Johnson Rutgers Medical School. She is also Associate Director of South Asian Total Health Initiative, works very closely with Dr. Sunanda Gaur. She is also Medical Director for Reach Out and Read, New Jersey. She wears many hats and very knowledgeable, and she is working diligently on her very favorite project. And what is that project? Wait a minute, we will hear it from our specialist. She is right here in our studio. Dr. Ramachandran, I would like to welcome you to TV Asia special series on Telugu channel, SATHI series.
Thank you so much, Varsha, for that very kind introduction. I'm so happy to be here and so happy to be able to talk to the community about some of the health issues that we face.
So, Dr. Ramachandran, without much ado, I would like to say, please tell us about your association with South Asian Total Health Initiative, because you are now Associate Director and very much invested in all the initiative that SATHI is taking in the state of New Jersey.
Absolutely. So my association with SATHI goes back almost 8 years. I first joined as a member of the SATHI Advisory Committee, and I was just blown away by all the good work that was being done through SATHI. And I was, really impressed with Dr. Sunanda Gaur and her commitment to the health of South Asians, not only in New Jersey, but elsewhere in this country as well. And the commitment of SATHI to community outreach, community education, as well as research. So once I had my foot in the door, it just sort of one thing led to another. I got involved with more and more projects that SATHI was doing. And 2.5 years ago, when Dr. Gaur approached me about taking on the position of Associate Director, I jumped at it because it gives me an opportunity to impact the health of South Asians here in New Jersey.
No, I didn't want to interrupt you because I see the excitement and the eagerness on your face and how you are really committed and dedicated to all the initiative that SATHI has taken. So tell us, what are some of the SATHI projects or initiatives that you are currently involved in?
Sure. So over the years, I've been involved literally in all aspects of what SATHI does. So in terms of community outreach, I've been to different places of worship, temples, to health fairs, etc., doing a lot of community outreach and education. And I have been especially part of the SATHI Sehat project, which involved teaching the community about healthy diets, etc., in a temple setting. And currently, I am leading the Cello project, which we'll talk about in just a second, as well as the South Asian Diabetes Prevention Project. So I hope to talk a little bit more about both of those projects today. But, they're both really close to my heart and really important projects.
Thank you, Dr. Ramachandran. So first of all, my question would be, when you say CHELLO, I believe that this is an abbreviation. So what is CHELLO?
Great question. So CHELLO stands for Child Health Action to Reduce Obesity and Oral Health Risks in South Asian Children. So that's where the CHELLO abbreviation comes from. And it sort of, I think it fits very well because we're like, CHELLO, let's improve the health of South Asian children. What it is a study which self-explanatory, that aims to reduce the risk factors for obesity and oral health risk in South Asian children.
Okay. So I was just smiling at when you said CHELLO, and when you also associated with like, let's go kind of moment. Sati is really well known for this really catchy project names. Because I remember Sahas is almost like adventure, which was for the stroke, and then Sehat, which is again what you are going to talk about, is Sehat is good health. So really great way to have a community outreach, and actually the terminology with really resonates with the cultural meaning of that word. So talking about CHELLO, which is like currently your main project that you are focusing a lot, I really want to ask you, why did you think of this CHELLO? What is the reason we are doing CHELLO?
Sure. So, so as I mentioned, CHELLO, the main goal of it is to reduce the risk factors for obesity and oral health risk in South Asian children. And it's actually funded by the National Institute of Health. It's a 5-year study, and it is a collaboration between us and the Albert Einstein College of Medicine. And, the reason that I think the National Institute of Health funded the study is because it really addresses a significant problem in the South Asian community. And as you know, we are, as South Asians, our numbers are growing, and we are one of the largest minority groups in the country. And most people are beginning to become aware of the fact that as South Asians, we have a high risk for chronic diseases such as diabetes, heart disease, etc. And, one always thinks of these diseases as something that is a disease of midlife, right? Something that adults get. But one thing that is really important for all of us to recognize, both the South Asian community as well as physicians who serve the South Asian community, it's important to recognize that research has shown that some of the risk factors for chronic diseases like diabetes and heart disease, they can be seen, or the precursors to them have been shown in South Asian children as young as 3-4 years of age. And in fact, even there was one study in newborn children from the UK, which looked at body fat composition and certain other metabolic markers in children, in newborns. And they were able to show that even newborn South Asian children had more body fat and other risk factors than newborns of other groups. And so that is something that's, it's when I first heard about it, it sort of took me aback, So I think the takeaway from that research, that has been, done across the world, is that, South Asian children are at risk already for these chronic diseases that will develop into adulthood.
Wow.
And then, and also the fact that, we do have these predispositions, these risks, right? And when we as an immigrant group adopt more of, the Western diet and the bad aspects of the Western diet with more, fast food intake and sodas and sugar sweetened beverage intake, it just, sort of compounds that risk. And so it's really, really important. Obviously, measures to sort of prevent diabetes, detect diabetes and heart disease early and intervene in adults are important. But it is really also equally important to study these issues in South Asian children, and to also start looking at interventions to improve the diets and lifestyle habits in South Asian children. Because what children learn in childhood, it's sort of those habits stay with us throughout life. So it's important to study these things and to intervene early and to really make sure that South Asian children develop really healthy habits right from the beginning. So that is sort of what this study is seeking to do. And that is why it was funded by the National Institutes of Health here in New Jersey, and then Albert Einstein is in New York. We're sort of located in a great place to look at these issues within the South Asian community, being that there are so many of us here.
Wow. So, Dr. Ramachandran, what I heard from you, and as you talked about the risks in South Asian children, it means that they actually have a genetic predisposition to have more fat cells in the body, which means they are at risk for having more fat deposited in these cells as a child when they are born. So it's a hereditary or genetic risk now combined with a risk again how they eat during the childhood. I believe that what you're working on is a very significant project having a long-term impact, because now you are working on something where you are trying to nip something in bud, like have those eating practices or physical activity practices starting right from their childhood, so you prevent future chronic diseases in future. I believe, in my opinion, it's a very significant project and it can have a strong and long-lasting impact in South Asian community. So viewers, if you are watching this, I would say pay attention, because this information can change so many things, the way we South Asians are looking at our eating habits as well as our physical activity habits. So Dr. Ramachandran, my second question, or going further down the discussion, I would like to ask you, did you start project this year, or this project has been active for a couple of years? Where are you? Where exactly your research is at?
Sure. So this is a 5-year study, and we're actually we're in year 4 of it. So it has been well underway. And as you mentioned, Varsha, there are, the body fat composition is higher. There's other genetic predispositions that we have. And some of in those kinds of things, we cannot really change with the state of the science at this point in time. Maybe sometime in the future, there'll be, ways to treat those factors. But we can definitely make a difference in terms of the diets and the lifestyle habits of our kids and ourselves, right? So that's what this study is sort of really looking at in great detail. And so we have finished. So the study has 3 arms. The first arm was to really understand the diet and lifestyle habits. And we focus on the very, very young children, starting at 6 months of age, and we follow them until 18 months of age. So the first arm was to just even understand what are the practices in the community relating to child feeding, and other oral health habits, of course. And you might wonder, why are we clubbing together, these obesity risk factors and oral health risk factors? And the reason for that is that a lot of them have common risk factors. Sugary foods and sugary drinks cause obesity, but they also cause dental caries and cavities and things like that. So That's why we sort of used a common risk factor approach. Things that help one thing will help the other thing as well. So we interviewed several mothers, both in New Jersey and from the Bronx. These were detailed interviews. And we asked them about every aspect of their child care practices, especially where it relates to, feeding and diets, oral health, of course, and then physical activity, their attitudes towards all of these things, etc., to really understand the problem and understand the practices, the attitudes in the community. And so that we will be able to address them better if we have a better understanding of it. The second arm of the study is a randomized controlled trial, often educational intervention. So we have designed based on what we already know, as well as all the information that we got from the interviews with South Asian mothers. We designed an educational program that is delivered by trained community health workers. So these are people from the community, and they undergo a lot of training. They're given tools, etc., to go into families' homes and do education with the families every month, starting at 6 months of age all the way until 18 months of age. And then we have research assistants also going to families' homes and then doing more interviews with the parents, also other members of the family, like grandparents, because we know in South Asian families, it's not just parents, there may be other people living with the child who have a major impact on what happens with the child. And so interviewing grandparents as well, other relatives, and then also monitoring children's growth as well as their oral health. We have like this really cool oral camera, which takes pictures of the children's teeth as they erupt, as they come out, etc. And so we kind of take pictures of that, etc. And we follow the kids up until 18 months of age. And we are, in fact, starting to follow them for even longer and sort of extending the study as well. So that is the randomized control trial. So we're looking at a group of children whose parents have received this educational program in their homes and comparing their outcomes and their behaviors, etc., to another group which got just regular care in their pediatrician's offices. So we're trying to see if this intensive educational program can actually make a difference. So that is the goal of the randomized control trial. And then there is a third arm, which is the where we take the information that we got from the interviews with the mothers and from the randomized control trial, and then we create educational modules for both professionals as well as for the community. So that is the third arm. And we're sort of starting to work on that already. We're starting to create professional education materials because it's very important for anyone who takes care of South Asian children to be aware of the fact that South Asian children have these extra risks, to be able to counsel South Asian families effectively about how can they address these risks. So we started off by actually also interviewing pediatricians in the area, both all over New Jersey as well as in the Bronx, to understand what are their perceptions of the major health issues in South Asian children, and what are the challenges that they're facing in delivering care to them, and what are some of the barriers that they're facing, so that we can design education for pediatricians that sort of really addresses those specific barriers that pediatricians have identified, the challenges that they've identified. So, we're done with the interviews. We're in the process of analyzing and writing up the results from those interviews. So that's where we are in terms of, the study. And what we've seen is, what we've seen both from the interviews with the mothers is that there are some feeding practices in our community, and we are all aware of that. I'm guilty of that from when my children were much younger. There is this, I think we feel more pressure to sort of really make sure that our kids are well fed. We feel this big pressure. And I think we sort of really, that is one of our top priorities as South Asian mothers, that we have to, get our kids to eat. Et cetera. So that is something that we did see in some of the interviews that we did. That is something that came up a whole lot. And very interestingly, when the interviews with the physicians as well, that is the number one thing that they mentioned. So we interviewed South Asian pediatricians as well as non-South Asian pediatricians. Anybody who saw a good number of South Asian patients, we reached out to, and everybody, all pediatricians, 100% of the pediatricians that we interviewed felt that the big problem that they're seeing in their South Asian families had to do with feeding. Whether and a little bit, the fact that parents were just very preoccupied with getting their kids to eat, and things like that. So that was a big thing that came up with the pediatricians. And also, interestingly, they also brought up other things that we weren't actually looking for, but it just came out when we were talking to them about challenges that they're seeing in South Asian families and children. Another thing that they talked about was mental health issues, that a lot of South Asian adolescents that they were seeing, and even like preteens that they were seeing, they are noticing a lot of stress, a lot of emotional issues in those children, etc. So that's another theme that came out of all those interviews with pediatricians.
Yeah, and we always see that in food has a definite relationship with our mind. And it's very interesting that you point out that you also noticed that in South Asian children, you saw some degree of relationship between their eating habits as well as mental health. And as you said,
Varsha, they were almost two separate things that pediatricians mentioned. When we asked them, what are the big challenges that you're seeing? And pediatricians sort of mentioned the two things. One was the feeding habits and the diets of South Asian children. And then another big problem that they saw in the South Asian community is that the preteens and the teenaged kids seemed to be more so than other groups of children. They seemed to be under more emotional stress, whether it was from academic stress, the stress to really perform well, or stress due to cultural mismatch between what their friends were doing and what their parents wanted them to do, those kinds of things.
So, oh, wow. So there was no connection between eating.
Yeah, I'm not sure that there was an actual correlation that we saw between the feeding issues and the mental health issues. There might well be, but it's not something.
That's a separate, probably there is a separate study that you will look at. But I did not want to interrupt you because you were speaking so passionately about your 3 arms and then your experience with the mother, and then you thought about having these interviews with pediatrician to get a comprehensive picture. I wanted to just touch on your journey of recruitment. How did you manage to reach out to these women, the mothers in Bronx as well as New Jersey? Because we know that it is always an uphill task when we are trying to recruit our South Asian community into any of the studies. So please share with us.
Varsha, thank you. This was a big, big challenge, very big challenge. And I'm glad you brought it up because it was really, really, really hard to recruit participants, especially for the randomized control trial, which was a year long. And despite the fact that we do compensate parents for the time for the study, etc., even getting parents just for the interviews, it was harder than we imagined. So we did a lot of recruitment through word of mouth, through places of worship, through different listservs, etc., some Facebook groups for South Asian mothers, and so on. But it has been a very, very difficult thing to do, to recruit South Asian families. And this is one thing that I would really like to appeal to all South Asian families. So there's been research in South Asian, especially children. South Asian children, most of the research has come, of course, out of South Asia, but also out of the United Kingdom, some from Canada, some even from Australia. But there is not a whole body of research on South Asian children coming out of the US. And we know that we share genetic risk factors with South Asian children everywhere, obviously. Our kids share those risk factors. But they face unique cultural issues here. Their diets here may be different than the kids growing up in any other parts of the world, right? So there really needs to be, there really need to be more studies of South Asian children right here in the US to understand what is going on with them here. And so I would encourage, this is like a plea to everyone who's watching this show, to please, if you have a chance to, if an opportunity comes your way, to be part of a research study. And, this kind of research that we were trying to recruit for, it had no blood draws, it had no procedures, nothing. It was just a 1-hour interview with the mothers. Then it was allowing these community health workers to come into your homes every month to educate you. So it was something that doesn't cause any harm. The risks of harm were zero from this study. So, it's at least for something where there is no risk at all, I really plead with everybody to sort of take part in these studies. Yes, we're all busy. I understand that. But if we are to understand the unique risks that we face in this, in the US, and our kids face in the US, and if we want to build better health for our children in the future, we need to be getting involved in studies. And not just in South Asian studies, participating in other studies, because, when people are looking at things, in general in the US, I don't think there's a big representation of South Asians participants in those studies as well. So I think we as a community should make that something that we do a little bit more.
The community members, they really need to get this message about, unless you participate in research, we will really not have any data out there which we can share about, which is South Asian specific. So this is the right platform. This is the right platform to talk about it and make our viewers more aware about clinical studies, clinical trials. And there are many, many ways, and there are many resources, and definitely the SATHI website or the electronic media or the social media, we have a lot of information which we will be sharing in the later part of the show. In the SATHI special series, we will have an episode where we will be talking about where and how and whom to contact. So going further, Dr. Ramachandran, is there anything else that you would like to talk about Cello project before we move on to your another special project?
So no, I think that we covered most things that have to do with the Cello project. And we will soon be, even with the randomized control trial, we will soon be wrapping up, and, the information from that will start being available. And then we're hoping to publish, and we're hoping to move on to Arm 3, which is the education of the community as well as education of professionals.
So is it okay to assume that all this information will be available, the results as well as the educational module that you are preparing by 2021 or 2022?
So definitely yes, 2021, hopefully. Okay. That's our timeline for now. We did take a big setback, of course, like everybody else with the COVID situation, but we're hoping by 2021. We've already published the results from the interviews with the mothers. We're in the process of publishing the results from the physician interviews, but the randomized control trial is still in progress. So we don't we don't have the data from that. But hopefully by 2021.
And looking forward to that eagerly. So moving on to my next question is about your South Asian Diabetes Project. If you can share some key points about what exactly is this diabetes project, and what is your role, as well as what is your expected outcome of this study?
Great question, Varsha. So ours is a South Asian diabetes prevention project. And, the reason for the project is that our goal is to decrease the risks for diabetes that South Asians face. As you know, and I'm sure you've had other guests here that have talked about it, and Dr. Gaur talked about it as well, that South Asians have more than a 2-fold higher risk of diabetes, insulin resistance, etc. And they tend to develop complications much earlier, and they tend to develop, we tend to develop more complications from diabetes as well. And in fact, based on these risks, the American Heart Association, in their recent scientific statement that came out in 2018, they actually put out a scientific statement on heart disease in South Asians. And a lot of the risk for heart disease is because of diabetes. They had suggested as one of the things that need to be worked on is community education for South Asians in areas where the community congregates naturally. So places like temples, cultural and health fairs, etc. So they were recommending that in their scientific statement that they put out in 2018. And that makes a lot of sense. And so we applied for a grant to, start a diabetes prevention project. And it made a lot of sense to partner with a community organization to do this. And our partner for this project is the Sai Dattapeetham in South Plainfield, and they have been amazing partners. And Mr. Upendra Chivukula is a big part of the Sai Dattapeetham, and he put us in contact with them. And I have been, and Dr. Gaur, we have been amazed at how willing everyone has been to sort of cooperate with us, collaborate with us, and work with us. And we have been focusing on adapting a well-established, evidence-based CDC's diabetes prevention program, which is a lifestyle change program, lifestyle change curriculum. And we have been working at adapting that to make it more culturally appropriate and more acceptable to South Asians. So that is what this whole project is about. And so we've had several meetings. We have a South Asian registered dietitian working with us, a South Asian endocrinologist who specializes in diabetes working with us as well. And of course, the community members from the temple have been giving us a lot of feedback in terms of how to modify this existing CDC curriculum to meet the needs of South Asians. This, as I said, is very evidence-based. This program has been used for many years and has been shown to decrease the risk of developing diabetes by 58%, which is a big number. So this is why we chose this specific diabetes prevention program. And we are, hoping that by the end of this, we will be able to submit a South Asian modification to the program to the CDC for approval. And then once that is approved, to be able to implement a diabetes prevention program in the Sai Dattapeetham and maybe spread it out to other places of worship as well.
I'm really impressed with the whole outline that you described. And I think the greatest achievement is getting the South Asian community members completely invested in diabetes prevention program. And I would agree with you that there is a high risk already associated due to genetic and novel factors, the diet basically. I want to congratulate you right here because that program initiation itself is a success. And I'm looking at the way you describe that you are creating a curriculum which will be, it's possible it will be approved by CDC, which has possibility of distribution among all South Asian community members across the country. That's really impressive. And I would say it's a feather in hat of Sati, another feather. Thank you so much for sharing with us, because our viewers are learning that there is something being done in background for the benefit of entire community. And diabetes, we have an epidemic of diabetes in this country right now. It really requires an attention. So thank you so much for sharing this with us, Dr. Ramachandran. My another question was, when you're talking about this South Asian Diabetes Project, with this one small part of the community. If we look at entire New Jersey, we have a lot of South Asians spread across from Northern Jersey to Southern Jersey. Is there any plan to replicate this project at any different sites or in future, or have peer-to-peer education so that you can expand it? Is there anything that you're looking at?
Absolutely. Once we have the modification done for the CDC's diabetes prevention program, and once we get approval for it, we can implement that program in different places. So definitely that is our long-term plan, to implement, and as you implement, we will also get feedback from the community about the implementation, ways that we can improve, change, work on things, and we'll be looking at outcomes as well. Tracking the participants in terms of their, the markers in their blood, their diabetes numbers, etc. We will be, following them, and so that is definitely the plan. The long-term plan is to implement the program in the South Asian community, and to slowly build more and more sites where this can be implemented.
Thank you, Dr. Ramachandran. And I know that other than being very active Associate Director of South Asian Total Health Initiative, you are also a pediatrician. And I would like to ask you question about the Reach and Read New Jersey. And if you could share, being the medical director of Reach and Read New Jersey, what does your role entail?
Sure. So Reach Out and Read is a 30-year-old organization that started out of a small hospital in Boston. Well, not a small hospital, a small clinic in Boston. And it was started by two pediatricians. And the whole idea behind it is to give every child the skills that they need to start kindergarten ready to learn. And this sort of recognizes the fact that a lot of brain development happens in the first 3 years of life, even before the child hits preschool, right? So those first 3 years sort of form the foundation for all the development that happens. It's linked to what happens in those first 3 years is linked to future academic outcomes, future health outcomes, mental health outcomes, and so on. And so it's a period in life which is, when the brain is also like very receptive to environmental influences. And so the Reach Out and Read program, we train pediatricians to be able to talk to parents about how can they support their child's brain development the best in those early years of life. And we do it using the medium of books. But even more than books and promoting reading, the thing that Reach Out and Read promotes the most is those parent-child interactions. So books are just a tool. When you set up a regular reading habit with your child, you are not just introducing books and literacy and reading and language to your children, and you're doing all of that, yes. But the most important thing you're doing when you're doing that is that you're setting aside a time when your child has that, your undivided attention, and you're having those one-on-one back and forth conversations and interactions with your child. Especially in those first 3 years of life, those back and forth interactions have been shown to be the building blocks of the brain. When you have more back and forth interactions with your child, more, nerve connections happen in the brain. And so this is how the environments can affect how the brain develops. And this goes for everything. When you have those back and forth interactions with your child in those early years, you set them up for, better social and emotional skills as well. So that's what the Reach Out and Read program tries to do. So we provide books at well child visits. When you go for your checkups with your child, we, pediatricians give out an age-appropriate book, and they talk to parents about why reading every day is important with your children, even starting at 6 months of age. It kind of, it takes some people aback by saying that you can start reading to your kids literally even from birth if you want to, but definitely from 6 months of age when they can sit up, when they can, flip the pages of a board book, etc. So that's what it's all about. And as the medical director for Reach Out and Read New Jersey, I kind of oversee the different Reach Out and Read sites throughout New Jersey. We reach, tens of thousands of kids through New Jersey. We have over 100 sites in New Jersey. And I'm involved in the National Reach Out and Read organization as well. And we're looking at different things, studying the impact of Reach Out and Read and how can we make it better, how can we enhance it, and so on, especially for the most vulnerable children, children whose families face socioeconomic difficulties, etc. So that's what I do when I wear that hat of the Reach Out and Read.
Mm-hmm. It is interesting to learn that being a pediatrician who has really a sense of creating something unique for not just your patients, but all the children who are in that age range. I see that altruistic strain in you and how you have maintained that for past 13 years. And as a Sati Associate Director, I think you are bringing like everything together, not only in your Cello project, but in your South Asian Diabetes project. So Dr. Ramachandran, it has been really a great pleasure to have you on this show. And I'm sure our viewers have learned so much today. First thing that they have learned that, yes, they need to volunteer and enroll for clinical trials, clinical studies, especially in South Asian focused. You also shared that there is a program, Reach Out and Read. So ask your pediatrician, what is Reach Out and Read? And find out if you are parents of a 1-year-old, or even if you're expecting a baby, you want to get started early, right? So there are so many resources, and I believe viewers will learn a lot from this episode. And then we will look forward to the final phase of your Cello project, where you will have all the data and educational materials for all our viewers. So thank you, Dr. Ramachandran. And I really appreciate your time and all the information that you shared with us on this special Sati series episode. So viewers, I will say bye for now and thank Dr. Ramachandran for her time and everything that she shared with us. Don't forget all those pointers that Dr. Ramachandran has given us today, because that's going to make a great impact for us South Asians in future and for our children in future. So I'm saying bye for now. Your host Varsha Singh for a special series, Sati series on Healthline on TVASIATELUGU channel. Don't forget to watch our next episode, where we will have another special guest, just like Dr. Usha Ramachandran, who will bring a lot more information for you. Bye for now. Thank you.
Thank you so much for having me. Total pleasure.
Thank you, everyone, and see you next time on our next episode of Healthline Sathi series on TV Asia Telugu channel. Your host Varsha Singh saying bye for now.